government's announced it's going to push ahead with the compensation payments to infected blood victims, and the first payments should be made by the end of the year. The previous government announced the scheme in May after the publication of the public inquiry into the scandal. Some campaigners feared the payouts might be delayed because of the election, that transfer of power at number 10. Well, just to remind you, the infected blood scandal has been called the worst treatment disaster in the history of the NHS. More than 30,000 people were infected with HIV and hepatitis C from contaminated blood products and transfusions. That was taking place sort of between 1970 and 1991. Some people may well be infected and don't know about it. Well, earlier I spoke with the co-chair of the Blood Inquiry Report. That was Professor Katharina Hauck. And I began by asking how she went about what is so difficult to do. How do you quantify the harm that's been done to the victims?
We tried to do justice in the way that we as academics can do, in providing estimates of this burden as well as we could. So really, it was very difficult to do that because we needed to value lives not lived, or lives that were not lived to their full potential. And we could only do that because there was so little information on the actual individuals that were infected. So we didn't know really when they were infected. We didn't know when they die and how many died of them. So that is all still now uncertain. So we used data analytics and modeling in order to set up some hypothetical pathways that used estimates as much as we could from the available data.
It's really difficult, isn't it, when you see something as horrific as this and then trying to sort of using data to quantify the amount of harm, the amount of hurt, the cost to it. Just from the victims that you've been speaking to, what do you think of the compensation that's been offered to them? I mean, there's been some kind of acknowledgement that no amount of money is actually going to remedy the harm that's been done.
Yes, absolutely. There is, I think, in the eyes of the victim, no amount of money that will be enough to compensate them for the hardship that they suffered and their families, and also some of the losses that are not possible to quantify. So how do you quantify different life paths? For example, the inability to have children, or to choose an education or to choose a job that you would have wanted.
It's difficult because, some of the victims have died. Many of them, actually. And, for families who are desperate to have had those answers, desperate for this all to have happened as quickly as possible. From your involvement in this, I mean, presumably it does take time to be able to come up with figures that you think are fair.
Well, yes, a lot of assumptions need to be made in order to come up with an estimate that is reflective of the current scientific opinion. We had to think about, how does hepatitis C infection progress? How did it progress in the 1980s, 90s, when we didn't have as effective treatments as we have nowadays? What were the side effects of these? How do we quantify that in terms of health impact? And also, it was very difficult for us to come up and in our modeling with an estimate, when were the individuals infected? How long did they live? How many years did they live with an infection? And what was their disease progression? So we had to really simplify our modeling.
I just wonder if there's one more question I can ask you, Katharina, which is just,
sure.
How are you feeling?
How am I feeling? Well, as academics, really, we try to be objective in our analysis and in our assessment. What I personally feel is that it is puzzling to me that in many countries where these blood scandals and these disasters have happened, these reviews and expert assessments and compensation discussions were done in the 1990s. So I don't quite understand why the UK waited so long to have this thorough inquiry that now thankfully has happened under Sir Brian Langstaff.
And we don't have an answer to that. That's Professor Katharina Hauck, co-chair of the Blood Inquiry Report, trying to go through that painstaking process to work out how you put a numeric value on the cost of this